Bismillahirrahmanirrahim. Today, our topic of discussion is heart failure. Definition of heart failure is when the heart is unable to pump blood around the body properly is called heart failure. Whether failure is in systole or diastole, it is classified into two: systolic dysfunction and diastolic dysfunction. Classification on the basis of site of failure is right-sided heart failure and left-sided heart failure. Left-sided heart failure, it is the most common type of heart failure, and it is also called a forward failure because the left side of the heart cannot eject blood into aorta, and this decreases left ventricular output results in increased left atrial pressure and pulmonary venous pressure, which causes pulmonary edema. Right sided heart failure. This is also called a backward failure because the right side of the heart cannot pump blood from the venous system to the lungs and blood accumulates in the venous system. Causes of right sided heart failure are left sided heart failure, which is the most common cause, chronic lung diseases, pulmonary valvular stenosis, and pulmonary embolism. Drugs used in heart failure are ionotropic drugs. Positive ionotropic drugs are those drugs which increases the contractility of the heart. Vasodilators and other miscellaneous drugs. Positive ionotropic drugs are cardiacglycosides and beta agonists. Cardiacglycosides Cardiacglycosides are no longer considered first line of drugs in the treatment of heart failure. And what's the function or what's the mechanism of action of cardiacglycosides are actually cardiacglycosides inhibit sodium potassium ATPase pump of the cell membrane. This increases contractility of the heart, which increases ventricular ejection. You will understand it in the next slide. Don't worry. Example is digoxin. This is the diagram of this channels or pumps of the heart cell membrane. There are mainly three channels. One is sodium potassium ATPase pump. Second is sodium calcium channels, and third one is L type calcium channels. Our interest is in these two channels. Sodium potassium ATPase pump pumps three sodium inside and three sodium outside the cell and two potassium inside the cell. What? Sodium potassium ATPase pump pumps three sodium outside the cell and two potassium inside the cell with the expenditure of energy. So when sodium comes inside the cell, it will produce ATP. So cell said to sodium, do not make ATP for us. Just pump out this calcium from us. So when sodium comes inside, calcium is transported outside the cell. So this regulates the calcium level in the cell. When this pump is inhibited, so there is no sodium inside, so calcium is not transported outside the cell. So calcium will pool or accumulate in the cell and intracellular calcium level will increase. And you know that cardiac contractility is due to actin and myosin bridges, and actin myosin bridges is due to calcium. So when calcium increases, this increases contractility of the heart. This is the simple mechanism of the digoxin. Beta 1 agonist. What are beta 1 receptor agonists? Beta 1 agonists are those drugs which stimulate beta 1 receptors. So it is also like cardiac glycoside, it will stimulate cardiac contractility. So both These types of drugs are used in acute chronic failure. In heart failure, systolic function is markedly depressed. So beta 1 agonists activate beta 1 receptors, which increases heart contractility. And these are useful in acute failure, not in chronic failure. Example is dopamine. Vasodilators. It Vasodilators, as I previously discussed in angina lecture, that vasodilators dilates blood vessels by relaxing smooth muscle of the vessels. When venodilatation occurs, it will blood will pool in the veins, and there will be reduced blood flow to the heart. When blood so it will decreases preload, and it will also vasodilators will also relax aorta, so there will be less pressure required by the heart, by the left ventricle, to pump blood into the aorta. So simply it means that less pressure will be required to open aortic valve, so it will decrease afterload. So vasodilators decrease preload and decreases afterload. So while vasodilator therapy can be dramatically effective, in which increased afterload is a major factor in causing the failure. Miscellaneous drugs are beta antagonists, loopdiuretics, and ACE inhibitors. Beta antagonists are simply beta blockers which inhibit beta receptors. Beta blocker slows down the progression of chronic heart failure. Example is carvedilol. ACE inhibitors, angiotensin converting enzyme inhibitors. What's the how angiotensin is activated, and what's the role of angiotensin 2? Actually, angiotensin is there is angiotensinogen in liver, and it is activated by kidney enzyme called renin. Renin enzyme is produced by the kidney, and it acts on angiotensinogen and converts into angiotensin 1. And angiotensin 1 is converted to angiotensin 2 by angiotensin converting enzyme. And this angiotensin 2 constricts blood vessels, so it increases preload, or simply it increases work output of the heart. And in chronic heart failure, we must have to reduce the work output on the heart. To reduce output on the heart, we have to reduce the formation of angiotensin 2. So simply we inhibits angiotensin converting enzyme, so angiotensin 1 will not be converted into angiotensin 2. So this will help in regulation of hypertension or BP, which will help in slow progression of chronic heart failure. As I previously said, that angiotensin converting enzyme inhibitors dilate blood vessels to improve blood flow. This helps decrease the amount of work the heart has to do. Loop diuretics. Before discussing loop diuretics, here I will discuss one important pump. This pump transport or reabsorb to calcium, sodium, and potassium from urine back to the loop of Henle of the kidney. So it is located on the loop of Henle on kidneys. So when these ions, sodium, potassium, and chloride, are reabsorbed, the loop of Henle will become hypertonic, and it will cause diffusion of water back into the loop of Henle of lumen, which will increase body fluids. And if this pump is inhibited, then if this pump is inhibited, then what will happen? Then body fluids will decrease, and in the it will helps in maintaining blood pressure, and which will help in regulating or slow progression of chronic heart failure. Loop diuretics inhibit co-transport of sodium, potassium, and chloride, which causes sodium chloride diuresis, due to which blood volume is excreted, and it will helps in regulation of body fluids. And due to this, extra volume or of body fluid is excreted, and edema is also reduced in this. So these type of drugs are used in edema and in chronic heart failure. Thank you so much.